Yeah. So, Dr. Davis, I have an implant that when I push down on it, it hurts right at the base where it meets the gum. Typically, what do you think causes that?
Pain radiating from implants can be a response to one of three factors. The first is that you could have infection in the soft tissue, the gum tissue surrounding the implant. The second factor is that we could have pain in the bone that's underneath the gum tissue and in between the tissue and the implant. And the third is that the prosthetic, that is the tooth or the denture-based structure on top of the implant, could have some type of malfunction or be loaded incorrectly, causing pain on both the tissue and the bone. Let's take an example that we provided here. This patient came in during the previous week, and the patient has pain when the patient pushes against the gum tissue. On the other implant that the patient has a really nice healthy collar of tissue and can push all day long. Actually, as it turns out, they can see the denture with no problems. However, in this area, the true problem is that the patient does not have adequate bone between the tissue and the implant that protects the tissue. So can you imagine every time the patient pushes or a denture pushes against the tissue has nerves and blood vessels that causes pain when it pushes against metal. So the simple solution is to go back in, have a consultation. In this case, we determined that the patient needed to have what we call an implantoplasty. That's removal of some of the threads of the implant along with the connective tissue graft, and that resolved the issue.